Welcome to part 2 of our conversation about inquiry-based science and rare diseases. Now that we have some background knowledge, it's time to start our investigation. Instead of going through charts and tables comparing the 5 E's to traditional classroom approaches, let's explore it for ourselves and dig into the second of 5 lessons from the Rare Diseases and Scientific Inquiry resource. Each of the lessons in this book represents one of the 5 E's that we talked about in part 1. In this lesson, you will be concerned with this question: what causes rare diseases? As part of this activity, you will assume the role of medical officers who are in charge of looking after the health of soldiers at an Army post where new recruits are trained. You may wish to work alongside a colleague online in the LINCS science community or in your own local program. Your task as medical officers is to examine the list of all visits to the infirmary during the previous week. You are looking for any patterns that would indicate a health concern on the post. You will need a few tools for this activity, including a piece of paper and pen to capture your findings from your research. You'll also need to go to Lesson 2, What Causes Rare Diseases, to access Activity 1, Infirmary Visits for Week 1. You can click on the link on the slide to get started. It's also in one of the resources that I provided in the opening discussion, and you can start from there. You can also download a copy of Master 2.1, the Medical Officer Report form, and Master 2.2, Visits to the Infirmary, Week 1, if you prefer to work with a printed version of the online activities. What I'd like you to do is to look over the reasons that each soldier went to the infirmary and to think about the nature of the causes of the soldier's complaints. You can record your observations on your paper or on the downloaded medical officer report. This task should take less than 5 minutes. After you have had a chance to look over the information on the new visits to the infirmary week 1, I'd like you to report back to the science community about your findings to this question. This question being, what are 2 general reasons why soldiers reported to the infirmary? Pause the presentation now and see what you can find, either using the online resource or the printed version, PDF version. Notice that if you do use the online version, you can actually sort the material using the tabs at the top of the screen. As you found in your discovery, soldiers may become injured for a variety of different reasons. What about sickness? Recall that at the start of this presentation, in part 1, we briefly mentioned that there are 3 general causes of disease: genetics or heredity, infectious agents, and exposure to environmental toxins. Which of these 3 causes is most likely to be responsible for a health problem that can spread throughout the post? You probably have found that it's an infectious agent. As you continue your investigation, you'll need to look back for any potential health threats to the post. You'll want to take note of any patterns or cases that worry you. You may already have found a few. If so, I'd like you to share those findings with the science community before moving forward. As medical officers, you have the ability to test for the presence of different species of bacteria that had previously infected soldiers on the post. 2 different tests can be ordered. Test 1 looks for infection by bacterial species A, B, and C. These species are associated with common infections for pink eye and sore throats, as well as infections resulting from cuts and abrasions. Test 2 looks for bacterial infections associated with skin rashes caused by Rocky Mountain spotted fever or Lyme disease. Test 2 also looks for exposure to poison ivy, not caused by bacteria. Note, while it is true that medical tests sometimes look for multiple causes at the same time, the tests described in this activity were created to make the test ordering procedure easy for students to carry out. In this next activity, you will decide which lab tests, if any, to perform on which soldiers You can summarize on your paper or on Master 2.1 which tests you ordered, which soldiers were tested, and why you ordered each test. To order your test, return to the website on the screen and select Activity 1, Infirmary Test, Week 1. Determine which tests, if any, you want to order for each soldier. When you have finished, select the Order Test button. When you have finished, return to the science community and share your findings with the rest of the medical officers to reach a consensus about which tests, if any, should be ordered and for whom. So 3 days have now gone by and your test results are back for your patients. I'd like you to return to the website that we've been using and click on Activity 1 Lab Test Results. The table that appears contains the same information about soldiers visiting the infirmary that was in Activity 1 Infirmary Visits Week 1. It also lists which lab tests were ordered, the lab test results, the patient diagnosis, and the patient treatment. For those using the print version, you can download Master 2.3 Test Results Week 1. Briefly summarize on Test Results Week 1 those cases with the potential to spread throughout the Army post, and to describe how they were treated. You don't need to list information about each soldier. Instead, you can describe groups of soldiers with similar complaints and test results. Be sure to share back on the science community about your summary. Another week has gone by, and you're ready to discuss the patient outcomes from that week. You also are going to present a list of new visits to the post infirmary. I'd like you to return to the website that we've been using and click on Activity 2, Follow Up on Week 1 Visits. Those using the print version can download Master 2.4, Follow Up on Week 1 Infirmary Visits. After you've had a chance to look over the information in the table, consider this question. Did you learn anything that causes you to be concerned? If so, please share this with your fellow medical officers in the science community before moving forward. Return to the website again, and this time I'd like you to click on Activity 2, Infirmary Visits Week 2. Those using the print version can download Master 2.5, Visits to the Infirmary Week 2. Click on Activity 2, Infirmary Visits Week 2, as before, to reflect on the information and summarize on your paper the soldier's reasons for coming to the infirmary. Remember, you're concerned about infectious diseases that might spread to the rest of the post. Go to the science community and respond to this question. Is there any evidence of a bacterial infection spreading throughout the post? You may have observed that the infection with bacterial species C that caused the pink eye is under control and is not cause for concern. You also may have observed that new cases of infection by bacterial species A are sending soldiers from other barracks to the infirmary with sore throats, which may be a cause for concern. Finally, you also may have noted that bacterial species A is also responsible for a severe foot infection in one soldier who developed a blister from wearing new boots. This analysis has you concerned about the foot infection that has quickly become serious. Observe that bacterial species A seems to be responsible for two different diseases, the inflammation of the throat seen in many soldiers and the severe foot infection in one soldier. Consider this question. Can the same bacterial species be responsible for causing two different diseases? You may not be able to answer that specifically, but I'd like you to consider the possibility that the same bacteria infecting different parts of the body might produce different symptoms. It is difficult to know whether bacterial species A can cause two very different looking diseases. The severe foot infection could be due to flesh-eating disease, which is a very rare, though very serious disease. Some research may help us to discover whether there is a possible link between bacterial species A and flesh-eating disease. You can look up flesh-eating disease in the Medical Reference Manual, which has a section on microbiology and disease. You should note that the next resource we'll be looking at contains 2 images of a patient with flesh-eating disease. One of the images is rather graphic and may be disturbing to some people. Once again, go back to the website and click on Activity 2, Medical Reference Manual. Those using the print version can download Master 2.6, Medical Reference Manual, Necrotizing Fasciitis. Everyone will want to download Master 2.7, Questions about a Rare Disease. Use the information in the Medical Reference Manual to answer the questions on Master 2.7, Questions about a Rare Disease. You'll likely need about 10 minutes to complete the tasks, and once you've finished, I'd like you to report back to the science community with your response to this question, which is question 5 on the handout. What should be the next step in treating the soldier with the foot infection? And I'd like you to explain your reasoning.